Hi, I'm Shruti More. Welcome to my LifePage. So today we'll be talking about occupational therapy, but before that, let me introduce myself. So I'm an occupational therapist and I'm talking to you today from Manali. I moved to Manali 5 years back from Mumbai out of for main two reasons: to work and to live a lifestyle which I live today. I've been born and brought up in Mumbai. I studied occupational therapy at Seth GS Medical College in KM Hospital, and there was a very unique life incident which happened, which kind of made me like relocate from Mumbai to Manali. So, occupational therapy is a branch of medical science which come under rehabilitation medicines. So, occupation in this context usually the first idea people have about when I tell them that I'm an occupational therapist is that I'm going to help them get a job. But in this context, when we say occupational therapy, by occupation we mean all the life skills which a person requires to be able to live an independent life. By life skills, I mean talking, walking, wearing your clothes, eating food, doing your grooming. For children, it could be playing, going to school, reading, writing. For somebody who's a professional, suppose if he's a teacher, then for a teacher, his occupational roles will be to prepare class lessons, to be able to talk. For a person who works in a bank or who is an engineer, for him the occupations would be that he should be able to use the computer, his rational thinking. So this is what we mean by occupation. Occupation in this context is all life skills one person would require to live an independent and a purposeful life. Human physiology is in a way that to know how your body functions, how are the various organs correlating and working in cohesion to be able to do what your body does. Patience, you will need a lot of it, and we work in a lot of difficult conditions in a way that we are working with real people having real problems, and most of our cases are very severe. So, and because the nature of the diagnosis is such that we wouldn't get quick results. It is not something like you give a medicine to this person and then in 3 days his symptoms are going to vanish. The rehabilitation process is usually a long process, and you really need to be very patient to see through the entire development which happens. For me, the greatest positive has been the job satisfaction. I kind of, because of the work I do, I feel that I have a bigger life purpose in my life, and it has given me a mission to accomplish. I also feel that I am in a position that where I can make a difference in whatever small or larger way. So there's immense satisfaction. Every day I have a feeling that I have helped somebody or made a little difference in a child's or the person's or in that family's life, which is very important for me at the end of the day. Because we work with children with disabilities or people who have lost some kind of body function, you are required to be able to move around a lot. Most of our children have spasticity, so when you are mobilizing them or trying to make adaptive weights for them, there's a lot of is required out of you to be able to lift them or position them. It also requires long working hours, so it is also physically demanding. So a regular day in my working day would be I go to my center in the morning at 9:30, and then we have our regular appointments given to children, and the parents come in with their children. So if I'm working with a child who has autism, in that 45 minutes of that session, my goal with that child would be. So we decide the goals after following through a assessment with the child, and also talking to the parents what are their main priorities. So children with autism, they have major difficulties in communication. They're not able to talk or express themselves in a neurotypical way. So in a session with a child with autism, my goals would be that he is able to purposefully engage with me. Children with autism usually do not make eye contact. So to make sustained purposeful eye contact is one of the goals I would have with that child. As I said, that occupational therapy is a very vast area. So I hope I've given you a little glimpse into what occupational therapy is. Thank you.